All right. Welcome, everybody. Many of you know me. I'm Dawn Ellison. I'm one of the core members of HRC, and Denise Wiseman is with us also. I'm not sure if any of our other core members will be joining us, but um, we're happy to have you here today. This workshop originated from a Healthcare Reinvention Collaborative poll question about the connections between societal issues and healthcare challenges. Brent answered with curiosity about how we might approach this from a systems perspective, and we took him up on that. Brent is an experienced facilitator and consultant who specializes in collaborative problem solving methodologies. He draws from multiple disciplines, including design thinking, systems thinking, lean manufacturing, and Six Sigma to help organizations tackle complex challenges. Brent brings both professional expertise and real world perspective to understanding how healthcare and societal issues interconnect. He has experience working across various sectors and is passionate about using creative collaboration tools to generate meaningful solutions. We are happy to have Brent here with us. Brent, take it away.
All right. Thank you, everybody. Appreciate you taking time out of your day to connect here. And I hope we have some valuable information and tools that you can put in your toolbox to grow your skills in collaborative problem solving, collaborative ideation. I'm going to share my screen and we'll be able to walk through the presentation together. If you can let me know in a moment if you can see my screen. Okay, so I want to share just a little bit more about me. I know you got a bio, but the one piece, a couple pieces that maybe Dawn didn't share were, yeah, I've come from a variety of backgrounds, work experiences, but really the personal element. I am a father and have three children that usually use two legs and another couple that use four legs. My story in healthcare really began when my oldest child, Travis, was born. And he was born with a variety of genetic abnormalities that led to a lot of complexity in his healthcare. And that started out with countless visits with geneticists to start out before he was actually born, and immediate trips to the NICU unit, ultimately to the PEDS ICU, and asking my wife and I to sign a do not resuscitate order on Travis at one point. It's continued there to regular visits with specialists, having to advocate with a health insurance company for him, and it's opened my eyes to just how complex it is to get healthcare in our current system, and how complex and difficult it is to navigate. And that really inspired me to use my skills in innovation and systems thinking to help out people like me who had experienced the complexity of our healthcare system. Now, I want to say, as a true system thinker, I don't think any of the people supporting these organizations are bad or have malintent. I think we're putting people inside a system that is not capable, not designed well enough to support the needs of patients in general. And so that's what inspires me to be a part of reinventing healthcare's driving systems that are more effective for providers and other organizations, the payers, and first and foremost, the patients. So with that, let me talk a little bit about my plans for this session. I want to start out in this session. Let me start by saying tools and techniques like design thinking and wicked problem solving, etc., are very big, and usually to do due diligence for them, it takes a fair amount of time. Perhaps you've had corporate experiences where you've had a consultant come in and work on design thinking or Six Sigma or lean practices with you, and often those take a day and a half or 2 days, sometimes weeks to do those initiatives. Obviously, we don't have that amount of time. So in today's session, what I want to do is just give you some basic whiteboarding, digital whiteboarding skills using Miro. There's a variety of other tools. This just happens to be the one that Healthcare Reinvention Collaborative has and I'm most familiar with. There's a variety of others. Then today I want to walk through common attributes of the different systems. As I've worked across my career, I've seen little bits and pieces of lean manufacturing and lean startups and design thinking and human-centered design and wicked problem solving and Six Sigma. And at the end of the day, we can kind of boil them down, even though they're trying to hit at different things, there are some commonality across these systems. And I want to talk about what those commonalities are. And they're mostly mindsets, how to approach problems or questions or opportunities to ideate and create something new. So as we do that, then we're going to do some quick exercises and examples together. In sessions 2 and 3 that are coming up, in a couple of weeks will be session 2, and in about a month, session 3, we'll actually begin to use some tools within these techniques to dive into that original problem of the connections between the social issues and healthcare system issues. Okay, so we're in Miro right now as you watch this presentation, and if you have clicked the link that Denise put in the chat function on Zoom, you can get into this presentation. And it looks like
the link is going in now, just so people know.
Okay. So I'm going to pause for just a couple of seconds and let you all get in that. And then Denise is going to use Miro's bring everyone to me function. And
shows we have 9 people.
Yeah, shows we have 9 people now.
I'm seeing them floating around on the screen. Love it.
Yeah, perfect. Go ahead and bring everybody here. It looks like we're ready. Okay, so if everybody is here, Miro is a really powerful tool. You might ask, why use a digital whiteboard and why worry about collaboration? I think we've probably all heard this already, but we're all finite, and so I might have one perspective and I know certain things, but when I can get perspectives and ideas from other people to combine with my ideas, and we're working collaboratively, the likelihood of a highly successful outcome is much greater. The power of a community is much greater than the power, strength, and knowledge of any one individual. Maybe there's some rare examples where that's not true with some super smart people, but for most of us, that simply is true. So that's why we use a collaborative tool. If you use a physical whiteboard, these things work just as well. We all live in a remote world now, so these digital tools are really powerful. If you'll follow my cursor as I move around, I'm going to show you over at the left side of the screen, you'll see a vertical toolbar. And that has at the top a select button and then icons for various tools. The top one is a sticky note. There's some shapes, there's text you can add to the board, and then this plus symbol that I clicked will bring up some more. For today, we're only going to use a few at the top. We might use the pen, the frame, obviously the shapes and text. If we scroll down, I'm going to do this real quick and scroll down. You can see there is a variety of other tools, including a tool that lets you do presentations. And Miro has changed recently, so I had to figure out how to do that myself today. But you can bring in your Google Docs, Microsoft Word documents, etc. Figma is another one of the tools that is much like Miro. Okay, moving around the board, I have a chart in here. I'm personally using a Windows device with a mouse, so that gives me a lot of freedom to, I think flexibility is the easiest way to use Miro. But I left some other options if you're using an Apple device with a mouse, or maybe you're just using your mouse pad on your laptop or a Mac laptop. You can do this on an Android device, although I don't recommend it. Screens are just too small. These give the actions that you need, or the actions you take to manipulate the board. So in order to select an item, this blue arrow here, if I click it off, this is one way of multiple ways. If I click it off, it automatically goes to a pan where you can move this entire screen around. I turn it on, it's in select mode, and I can select individual items out of the screen or any screen that we happen to be on. And then if I click again, I'm able to move them. So that's just a basic how you move around. If you want to zoom and you have a mouse with a trackball, you can just scroll your trackball back and forth and it'll resize the screen. I'm going to stop. If you have another device than my Windows device with a mouse, if you want to snap a quick picture of this, it's ready for your reference, that might be a helpful thing to do for the remainder of this presentation, because we're moving along, and I realize as I do these things that have now become quite natural, but you're maybe just learning for the first time, it can be challenging to remember keystrokes, key commands, etc. To move around the screen the way that you intend. Okay, so working with sticky notes and shapes. Again, if you follow my mouse, I'm going to go over and I am going to click on the sticky note and drag it over, and it happens to be a pink one. Now, the text in here is set at auto, so as you type and it fills up the space in the sticky note, it will resize the text. I can change the color of the sticky note by simply clicking on the color and changing it to orange. Okay. I can change if I want add bold. I click on that bold icon, or italics, and you click on italics. So whatever I type in here, or fat finger, it will be in italics. Okay. If you wanted to tag this, maybe you had common ideas, you could use this tag function, and you can show who wrote it. So if I click on that, suddenly my name, or the name my parents gave me, pops up. Okay. That's just a handy function. So awesome. You guys are experimenting. I love it. That's just what I want you to do. This is a great time to experiment. Make sure you've resized your shapes. I'm going to go to grab a shape instead of a sticky note. So I open up this toolbar. I'm even going to open it up for more shapes. And let's add a decision icon. And we drag that over and expand it. You can write in here, and you notice it always starts out really small. That's the 14-point font that my hand is now pointing to. We can just click on that and make it larger, and this would signify a decision that we were going to make, like, are we going to go to the next slide? If I wanted to connect this, I can simply click on this little dot here and drag it over to the hello that I have there, and we're connected. Now, one thing I want to share with you, because the last one that I did on here was fairly dark and large, is you can click on the type of arrow. If you want to make just straight lines, or you want a stepped line, or one that's wavy, you can select that with these functions. Let's go ahead and make it wavy, and let's make it a little thinner. We drag that bar at the top to make it thinner. If you want to make it a dashed line, you can select that at the bottom. Okay. And we have a black dashed line. You can even change the color with that. Okay. So are you guys ready for an exercise? It looks like you've already got a lot of practice. Let's go over to the next slide. We've got a simple exercise for you, and you'll get to do what you've already been doing, which is exactly what I wanted you to do. So let's experiment. So go ahead and put a shape in here and put your name in it. You can, very good. Somebody has enlarged theirs already. Tamara, looks great. Added your name. And then if you can, also at the same time then, or next as a step, draw a line of your choosing over to somebody else's shape. Oh, you know what? I changed the instructions on you. I wanted, I was also going to have you put in a sticky note of your own, just to let me know how you're feeling about this at this point. So go ahead and grab a sticky note too, if you can. And just write a quick comment. How are you feeling about using Miro? Ah, Denise, yes, of course. So I love the warm and fuzzy. All good answers and intriguing. All right, can somebody tell me what's intriguing?
I think I was hearing a question from somebody.
Yeah, please go ahead and jump in with questions at any time. I forgot to say that at the beginning.
A lot of issues connecting. Like I can't see my cursor on the screen. Like I have a cursor, but I can't get into the button thing with my name in the.
Okay. Denise, can you do the bring everybody to me again?
I just did. Did that bring you, Rachel?
Let's see. It doesn't seem like it. Maybe if I hit annotate here.
Are you visiting developer?
No.
I don't see your name.
Yeah, and I see my cursor, but it's just a black cursor.
Yeah, when it's your cursor, you don't see, like everybody else, you've seen all those floating names. You won't see that for yourself.
I just turned into a like a pencil.
That would be if you go to that arrow that Brent showed you at the top. If you click that, you should be able to get there you are. I see your name. I see that you just clicked there. Do you have your cursor back the way you want it?
There we go. I'm trying to add a shape.
Okay. I want to give you a second, Rachel, to try and to do these exercises real quick, or as much as you need. If you have experience with Miro, maybe they won't be as necessary for you.
I don't.
Okay.
We're getting there.
Okay. Let me know when you're ready, Rachel.
So I'm trying to like click and drop. That doesn't seem to be working.
Rachel, what kind of a device are you using?
And a MacBook.
I'm not a Mac user, so I'm not good at helping. Dawn is. I don't know if she can help. Dawn, you're on mute.
So, Rachel, if you have a mouse, it will help. I found that my trackboard on my device, my Apple device, doesn't work. Are you using a mouse?
I am not, but I can get a mouse.
Okay, that is probably what's going on because I need a mouse to be able to drag things.
Okay.
Despite the fact that it says you don't, you do. The trackpad doesn't work.
It makes life so much easier.
Yeah, it doesn't work with a trackpad. Yeah.
Okay.
Okay. I think if you're okay with it, let's continue on. Rachel, we'll work with you to make sure that you're up to speed. But I want to move over to a slide that well, I have it up on your screen. The tools that we're going to talk about, and I'm going to turn this over to Dawn in just a second, but the tools that we are going to talk about, these techniques, I told you earlier that they take a long time to do them in their grand glory. And so you wouldn't want to use them in every circumstance. And just share that. Go ahead, Dawn.
Yeah, so I thought it'd be helpful to talk a little bit about the Cynefin model. This was developed by Dave Snowden while he was working at IBM in the late 1990s. Snowden was a director of IBM's Institute for Knowledge Management, and he created this framework to help the folks within the organization understand different types of problems and decision-making contexts. The word Cynefin is Welsh. It means habitat or place, specifically referring to the multiple factors in our environment and experience that influence us in ways we can never fully understand. So it's meant to help people understand what their place is within a decision. So this model identifies 5 domains that describe the relationship between cause and effect in different situations. So the first domain is simple, obvious, and a lot of times people call it clear. So within this domain, best practices apply. The relationship between cause and effect is clear to everyone, and the approach is to sense the situation, categorize it, and respond with established best practices. So there's typically one established way to handle these situations. Think a recipe for baking chocolate chip cookies. The ingredients, measurements, and steps are clearly defined, and if you follow them correctly, it leads to a predictable result. Good chocolate chip cookies. The complicated domain is one in which good practices are needed. Cause and effect requires analysis or expertise to understand, but the relationship between cause and effect is knowable. The approach is to sense and analyze, then respond, often requiring subject matter experts. Now, multiple viable solutions exist, and different experts might recommend different good practices based on their analysis. Multiple expert perspectives are valuable with a complicated problem to identify the best approach. So think about diagnosing an unusual medical condition. The cause and effect relationship exists. but requires specialized knowledge and analysis to determine the right treatment from several possible options. So the Mayo Clinic, when it was originally being designed, thought about this and designed their clinics so that multiple specialists could be available to evaluate a particularly puzzling patient. So complex domain. This is where emergent practices come about through experimentation. So cause and effect can only be perceived in retrospect, not in advance. So here you probe first with small experiments and sense what happens, then respond based on what emerges. This domain offers the most potential solutions since multiple experimental approaches can be tried simultaneously with different paths potentially leading to success. Diverse perspectives are crucial here as they enable different experiments and help interpret emerging patterns. So think about developing a new approach to community health. You need input from residents, healthcare workers, local organizations, government, community resources, right? So small pilot programs reveal what works and successful approaches emerge through experimentation and adaptation. Then there's the chaotic domain. So novel practices are required for crisis situations. There's no clear cause and effect relationship in chaos. The approach is to act first to establish some stability, sense where you are, then respond to move toward more manageable domains. So options are constrained by the need for immediate action. So think the example for this would be a patient arriving at the emergency department with severe multiple trauma. Immediate life-saving interventions must begin before you can fully assess all the injuries or understand the complete picture. So you act first to stabilize, then assess what you're dealing with. That's the chaotic domain. And then lastly, disorder. So the dangerous middle space where you don't know which of the other domains you're in. The goal is to quickly gather enough information to move into one of the four domains rather than implementing solutions. So multiple perspectives here again help determine which domain you're actually in. So example, patient presenting with confusing symptoms that could indicate anything from simple infection, which would be a clear problem, to a rare disease requiring specialists, which would be a complicated problem, to an emerging health pattern in the community, think a novel virus, perhaps like COVID-19, would be a complex problem, or a medical emergency requiring immediate intervention, which would again be chaos where you just need to step in and stabilize. So the model helps leaders choose appropriate decision-making approaches based on the nature of their situation rather than applying a one-size-fits-all solutions. I realize that was a lot of information, but I just wanted to give you some basics so you can start thinking about where would we need a systems approach? Where would we need multiple perspectives? And you can see that there are different situations that are going to require different approaches. Back to Brent.
Yeah, at this point, I just want to stop and make sure everybody's on track. If there's any questions, we can address those now to this point. Okay, so now I want to get into mindsets that are common to all these different disciplines as we approach solving problems and ideating creative solutions. And I get to this from I have a couple of base philosophies. The first one, and maybe you've heard these, I'm not an original thinker in all cases, so I take these from others as wise statements. Yesterday's solutions become today's problems, okay? And I think if you look back over healthcare, we can look at, creations of HMOs, et cetera, and they were trying to address a problem in that moment that have later created other problems. The other, I guess, paradigm that I have is that using the same thinking that got us into these problems will not get us out. We need to use a different way of thinking, and that's where creativity comes in our approaches. So as we use those as grounding points, I'm going to go through 9 or 10 different mindsets that all of these tools have in place. So the first one, obviously, is it's an iterative process. We start with a question that's a central question. Maybe we do some research or some analysis. We synthesize it. We bring it together. And what are some key things that the data is telling us? And then we prototype it. That's the realize phase. And if we go through that cycle a few times, it will naturally converge towards a point of view, being able to articulate, this is what we need to do to solve this problem. This is an approach that has been used at IDEO, if you're familiar with them, and you've also heard the idea of failing fast. That's what this is let's put our best thought to it, but quickly try some things out in prototypes that inform us on next steps. The second mindset that as we use these tools, and if you want to go over, you can stay with me if you want with your cursors. If not, that's all right too. We have some exercises later on. So divergence and convergence. As we go through these processes, we want to be iteratively thinking through expansive. How can we expand potential ideas? Because as we're using creativity, in most cases, in an awful lot of cases, somewhere along the way in just social dynamics, someone will tell us, I know the answer, let's just do it this way. And inevitably, sometimes in expert opinions, as Dawn just talked about, those are really good ways, but often fail to be the best way. And so when we use divergent thinking and expanding on what is a possibility, that's an opportunity to get the best way out on the board. Eventually, we need to converge. So we'll take 1,000 ideas and we'll start to use filtering tools. Well, out of these, I won't say good ideas because I think every idea is a good idea. Some of them are just better than others. So we use filtering to bubble up the better ideas, the best ideas. And that's when we're doing convergent thinking. That's going to happen in design thinking, human-centered design, etc. iteratively. You can go through that cycle a number of times. Has anybody, I'm going to talk about a human-centered focus, and this is a best practice for creative problem solving. I'm going to use an example. Has anybody ever tried to reconcile information you get from medical bills and EOBs? It is nearly an impossible task. You'll get bits and pieces that line up, but you'll never, down to the penny, be able to figure out how did everything get paid, and this bill that I just received, I want to make sure that I really should pay it, but I'm not sure. On the back of your EOBs, you'll probably get some legalese. On the back of your medical bills, you'll probably get some legal terminology, and somewhere in between, you won't ever know exactly if you've paid all your bills. And that's one of the reasons that happens, is because those communications are often designed and developed by people with a very limited perspective, their own perspective, the systems they're using. Maybe Epic only allows this information to go through, and the technology team that develops the presentation thinks about what data is available to them. And there's probably some expert that and a legal perspective that say this is information that has to be on these documents. Very frustrating, and I'm guessing somebody else other than me has experienced that frustration. A better way, and this is proven through research on real humans, is to think through what is the human experience that we're trying to solve and improve. And so we do that by using human-centered design, getting a variety of perspectives. As you jump into the human perspective, a couple of things you want to keep in mind. These are down at the bottom of the slide. Empathizing with the users. Walk a mile in their shoes. Interview them. Shadow them. Experience what they're experiencing and what they're seeing. I don't know if you've ever had this. I kind of have a reminder for myself, and that is every problem I don't have to solve is really easy. And so I use that as a reminder for myself to actually, when I hear somebody bringing up a problem, stop, pause, and try to experience what that individual who's bringing up the problem is experiencing. And maybe if I look at it from their lens, I will see and feel the experience in a totally different way. Making sure you're defining the user's problem. It's easy as experts to stand outside and critique other people's problems, but do the diligence of going down and deeply defining what is the user experiencing, what are their problems, what challenges are they trying to overcome. And when we do that, we are going to come out with surprising answers that, maybe we just glossed over problems. Ideation, brainstorm. Again, this is similar to the past slide, so I won't dwell on it, but getting a multitude of ideas is important. Prototyping potential solutions, and then asking users for feedback. If we were able to do X, Y, and Z, would that solve your problem? That can be as simple as drawing maps out on paper. It can be making physical prototypes. In the IT world or the tech startup world, they do minimum viable products. They're not meant to do fully built out solutions, but they're representations of what could be done. Okay, and we're always constantly looking to improve. We start with the people and not starting with the problem. When we start with the people and we understand their problems, we are more likely to create solutions that will solve those problems of real people, and more likely to develop solutions that people want, which is also a key element. Okay, I want to pause again and take a breath, ask if there's any questions at this point. Okay. Assuming there's not. This is a close cousin to the previous one, is collaboration and stakeholder involvement. I'm going to lean on my automotive experience real quickly here and just talk about a classic Ford scenario that they had a series of problems on vehicles with failing brakes, and they would go to the engineers, and the engineers would say, I know the problem, and go develop a fix, only to have the same problem keep raising its head. And it wasn't until they got out and started asking other audiences, users, when is this occurring, etc., that they really got to the root cause. And I just use that as an illustration of talking about understanding who are the stakeholders in any problem we want to solve or any problem we want to fix or ideation. People who are tied to it are really good resources, not the exclusive resources, because you want to get a multitude of perspectives. But when we're asking people who are linked to it, it helps us to give the full picture of the problem and the full plate of opportunities for solutions. Okay. Not to mention that part, nothing about us without us. I think we've probably all worked in an organization at one time or another that somebody declared from on high how things were going to be done, and not understanding the full picture created a lot of problems for others. If we get everybody's buy-in and perspective, more likely that we can get some buy-in for trialing prototypes. Okay. Systems awareness, again, a close cousin of the previous one. As we use design thinking tools and problem-solving techniques, it is critical to understand the array of systems that could be influenced or involved in any decision we make. And as I entered the healthcare industry, I'll just candidly say, I was not always aware of how actions I could take in insurance from a product development standpoint impacted people in claims, in customer service, etc. So understanding the big picture of all the systems, and healthcare happens to be one of those, I'm sure you're all aware. It is a really complex set of systems and subsystems and an overall system itself with a lot of connections. And so being aware of that as you're developing solutions is critical. I could ask you to try and map this out. What are all the connections? And it would end up looking like a big plate of spaghetti. So let's do a little working example here. And this would be one tool that you could use to understand systems. It's called a causal loop. What you do when you're forming a causal loop is to draw arrows between all the things that are connected, and then you somehow communicate the relationship between them. So let's use an example where Brent here is really got to get some things done, and I'm a little tired, a little groggy in the morning. So what I do is I go get some coffee, and I drink it. There's a local coffee shop here who has something called a red eye, which is a brewed coffee with 2 shots of espresso in it, and that really kicks me up. I am ready to go. I am really alert, and so there's a positive relationship with them. If I drink a couple of those red eyes, then I'm going to be super alert, maybe even over alert, and I'll get a lot of work accomplished. So I'm going to ask for you now to fill out for yourselves, what do you think are the remaining relationships between getting a lot of work accomplished or not getting a lot of work accomplished and sleep quality? And how does this become a loop? Go ahead and draw some arrows, and I've got some positive and negative relationships already down at the bottom that you can grab if you want. Go ahead and draw on this screen. What do you think? Oh, okay, I'm going to go pick somebody from the list, and whether complete or not, go ahead and explain what you think would happen for the rest of the cycle. Sam, would you mind sharing how you would play the rest of the?
Sure. So the amount of coffee you drink also can have, if it's a high amount, can have a negative impact on sleep quality, which can then increase the level of stress, which would then negatively impact the amount of work you get done.
Yeah. Yeah. So let me say that in a slightly different way and just see if this illustrates something for you. Let's just say I had those red eyes, a couple of them, and I was super alert. Probably shouldn't have had as many as I had. I got my work accomplished. We'll just say that I did. But because I was jittery and had so much caffeine, maybe a little higher level of stress, or maybe I was distracted when I was doing my work because I had too much caffeine and my work wasn't high quality. So that leads to higher stress. That higher stress leads to poor sleep quality. The poor sleep quality then leads me to be tired in the morning. So what do I do when I'm tired in the morning? Go back and get more coffee. And the piece of this that I wanted to illustrate to you was, if we look at the cycle that way, and there's no right answer to this, but if we look at the cycle to the way that I shared, it becomes what's called a feedback loop. And so having coffee one morning to overcome being tired and overdoing it leads to me getting into this repetitive cycle of needing coffee every morning to get started and be productive, which later on leads to poor sleep quality. I mentioned feedback loops because you can have positive and negative feedback loops that can be detrimental in a system or positive. So if there were, for instance, a feedback loop in healthcare that caused people to get their primary care regularly, or the cycle of events caused people to be more likely to be adherent to their treatment plan, that would be a good thing. Maybe somebody who goes to the ER or misutilizes the ER has a cycle that causes them, instead of developing a relationship with a doctor, maybe they begin using ER because it was so simple and convenient the first time, and that develops a cycle of misusing or overusing the ER. That's a bad thing. And so feedback loops can be really powerful in system analysis. Okay, I'm going to stop and pause for a second and ask if we have any questions, if we've raised any questions. Okay. Rachel, are you still with us? Okay. Just wanted to If she was, to make sure that I had given her time to catch up. But
Hi, I am. I'm sorry. I got a call, work call that I had to step away for a second. So I'm a little behind, but I'm working on catching up. I did find a mouse.
okay, excellent. Thank you. And on one of these earlier slides, I did put a link to my LinkedIn page. I'd love to LinkedIn connect with all of you. I'm available at any time for follow-up on this if you want. But so we're going to move on to the sixth mindset, and that is, and this is common of many problems that you and I deal with in the workplace. The way that we frame the problem is crucial. I'm going to give a couple of examples. If somebody asks you, how do we cut costs? How do you answer that? There's just the way that question is framed. It's going to elicit a certain type of question, a certain type of answers. If instead, what we prefer to do in collaborative problem solving, collaborative ideation, we frame it in a slightly different way. Instead of how do we cut costs, how might we reduce unnecessary utilization? Another example would be, how do we improve population health? That's a big question. There's a lot packed in that. As an alternative, let's make it a little bit smaller and we say, how might we support aging adults in rural areas in accessing their preventive care services? That refines that question and gets it down just a little bit, something a little bit more actionable, a little bit more tangible to grasp. And that helps us in ideating answers that and possible solutions that will potentially be productive. Another little trick in there was, instead of using the word do as if it's very specific, there are only certain right answers, we use the word might, because psychologically we want to open up our mind to possibilities. Not everyone needs to be realistic. Sometimes those really wild ideas, maybe they don't hit the exact mark of the question, but what they often do is they'll spark somebody else's imagination, and they'll be an ignition or a flashpoint for a whole line of ideation that you wouldn't have gotten to otherwise. And so using words might that really make the questions open-ended is really important. So a couple quick guidelines. Obviously, we want to be human-centered in our approach, focus on the people and not the problems. We want to, and this is an art, not a science, and how we frame these questions, be specific enough without guiding exploration or determining the results. I don't know if any of you have ever had a manager who knew the answer they wanted when they asked the question. I have, and those were very unfulfilling discussions. So you want to be open-ended and invite creation. This is where brainstorming comes in, and avoid implying a specific solution. If you can kind of use those guidelines, chances are you're going to have come up with a really good question, one that you can really act on and get some good ideation out of. Okay, another opportunity for your work. You want to be open and introducing this to complexity. Do not shy away from complex problems. You might need to break them down. Do not shy away from the complexity. And this we kind of discussed when we were talking about a systems awareness. So I'm going to give you an opportunity to grab a sticky note, and I want you to talk about, write down the factors that impact diabetes management. So I have a sticky note pad. You can just grab one of the pink ones and slide it over, or you can grab your own sticky notes and fill up this page. Let's spend a couple minutes. And I do talk a little bit about this. I chose an iceberg. There's iceberg model, and the intention of it, as you know, icebergs, the majority of an iceberg is below the surface, and this is just a reminder to us to go below the surface, because what seems like a simple problem, managing diabetes, isn't necessarily that way if you really stop to think about it. Good one, Kristen. Very pertinent for our life today. Nice addition, Tamara, on the support. We're still adding them. This is good. These are all excellent. And I'm sure if I gave you more time, you would continue to add them, add to these. I don't see any stigma up there. Maybe it's that people with diabetes tend to be regarded as overweight, and when that's not necessarily true. Food insecurity. I think we have access to food, so those are similar. But yeah, even if I'm a rural patient versus a patient who lives in a city with good access to medical facilities, etc. All of those things. And so what first seemed like a relatively simple thing, diabetes management, really when we go below the surface, there's a lot to that. Now, this is a very rich diagram for starting if you had a question about how might we improve patient management of diabetes, of their diabetes. This might be a great starting point to say, all right, let's start to cluster this in areas where we can take some actions that make sense. Great work. All right, Kristen, I'm going to put you on the spot as we go to this next one, because the next attribute is visual thinking. You've all heard the phrase, picture's worth 1,000 words. When we draw it out, it helps everybody to see and understand clearly. So Kristen, I would like you, and I'm going to open this up so that you see where the pen is. I'd like you to grab the pen, and I'm going to ask you to draw 3 things that are that you value highly. Okay. Are you up for it, Kristen? Maybe you're on mute. There you go. You think you want to hit the plus sign down at the bottom?
Okay.
Good.
Yep. Give me a minute. So can you see what I drew?
I can now. Yes. That's.
All right. Just off the.
I want to share with everybody while Kristen is drawing this, drawing with a pen anywhere. Like, I don't know if you've ever had to sign something using your mouse pad or a mouse. It's really hard. And so this task that I've given Kristen is not necessarily easy. But what I want you to see is the power of drawing. Is even if you think I can't draw, simple images will convey information that becomes permanent. It's like a form of object permanence when we put it on a whiteboard that will convey the thoughts, and those are there for the team to use and understand very quickly at a glance as we build out solutions.
I have my 3 things, but they're up for interpretation. So what does everybody think my 3 things are?
So I'm gonna guess the first one is family, the people.
Yeah, this one here.
Yeah.
Yes, you got it.
I'll let somebody else guess.
Is home the box with the triangle?
Yes,
Or
I was
housing?
more security of I think security and having a home kind of to me conveyed that of a place to lay my head.
Okay. Same concept. I love it. And it's just that last one, I have to admit, Kristen, and I know it's a hard task. You don't have to be embarrassed at all. The last one's getting me.
I could see how it could. I couldn't think of quickly.
Anybody else have an idea? I don't want to monopolize.
The 99%?
Close. 99 plus.
Is
Longevity?
YO year old? Is that, yeah.
Yeah, I want to live a long time, a long life.
There you go. Mm-hmm.
Okay, got it. Well, excellent. I wouldn't have gotten that, but we pieced it together. It's our own form of charades on a whiteboard, or what is it? Pictionary. So This is very challenging to do on here. Nevertheless, we were able as a group to see these and understand them. And I just want to use that as an example and illustration, showing how when we make things visual, they resonate with us and it helps us in our ideation and problem solving. So always use that as a tool, make it visual. And then our final frame, and this is going to sound really, really similar to previous ones that we've done, but in all of these mindsets, it's really important to have a learning mindset or a learning orientation. Very rarely will we be able to look at a complex system and pinpoint the answer of what's wrong. But we can run small experiments and learn from those experiments very quickly to triangulate on what we want to do next or to take the next big step. And many of you have heard of the lean startup method. That's exactly what that is. And in fact, that illustration on the right of having an idea, building an MVP, measure the results or the user response, collect that data, learn from it to develop your next idea, what users want. That's where that comes from. The image on the left is from Six Sigma and Lean. If you've got a manufacturing problem, this is a process they go through to figure out what is causing that problem and how do we eliminate it. Okay, so you always ask your question, what can I do in the next 30 days, 60 days, 90 days to go through this learning cycle and learn the next thing on this complex system of healthcare that we're all working on? And what progress can I make because I've learned something new? And this is also where that phrase that we've all heard from Elon Musk and every famous entrepreneur is, fail fast. You're going to make a lot of mistakes, but those mistakes or those failings are what are actually learnings that help us to take the next step. Okay, questions with that? Okay, questions, because this is my last slide, and I think we have 7 to 10 minutes or something like that left. I'm going to put a plug in for session 2 and session 3, again, as a reminder. When we collaborate deeper, hopefully I picked a good visual. I'm not, of all the things I have experienced and all the things I am, a drawer and creative with artistic, I guess, is not one of them. But what I want you to see is that when we bring our minds together, we all have a piece to the puzzle that we're bringing together. So I want to emphasize collaboration. And when we collaborate, we're going to go further. We're going to collaborate in our next session, looking at social issues, which are labeled there, and health system issues, which are also embedded in there, and see how they interrelate in the next 2 sessions. And we're going to use design thinking and problem solving tools to do that. Those, as a reminder, those sessions are September 11 and September 25, 2 weeks later. Both of them are the exact same time as this session was, and I want you to, I put it in Eastern. Bring your insights, your intuitions, and leave with some impact. I hope to land at the end of the 3rd session by identifying some high impact areas where we can be working to resolve that conflict between social issues and health system issues. Okay, so that's my plug. I do want to open it up if there are any questions. I tend to get talking and I start using all nouns and forget about verbs. And so this is your opportunity to pause me.
So just as an example of a powerful question, like we were talking about earlier, rather than asking, do you have any questions? I'm going to ask, what questions do you have?
That is a great catch, Dawn.
No, that's okay. I didn't mean to correct you at all, Brent. I just wanted to give an example of how we turn questions into powerful questions.
Yeah, exactly.
Listen to the assumptions behind them, right?
Mm-hmm.
Well, I'm just going to say, Brent, this was really useful. I love having this review of the different, methodologies that we use in order to approach, complicated and complex problems. Jake says, thanks, good session. Need to do this as just-in-time training when we set teams to work on a specific issue. There you go. That's
a great application of this, and be happy to come back and support at that time. I will, of course,
just in time.
I will, of course, be back on the 11th and the 25th.
Absolutely. Who has a comment? Who else has a comment or contribution or a question?
I just want to take a moment to celebrate, Brent. You saw an opportunity. You raised your hand. One, you said, I think there's an opportunity with this question to go deeper. And when I came back to you and said, do you want to facilitate it? You said yes. That's fantastic. That's what we're all about, is shining a light on those of you who have the skills that can bring it forward to everyone else and then lead us in these solution-focused endeavors. Thank you, Brent.
Yeah, you're welcome. Absolutely welcome. And very gracious words. You forgot the part about me cowering in a corner first, but
Well, we couldn't see that. It was all virtual.
We saw you step forward, Brent.
Good. And I'm happy to do that for anybody. I do. Let's just say real quickly, my heart is, this is a big challenge for everybody around the world. And we're in this together. So let's help each other solve where we can solve. Every little step we take is a step forward. So don't ever hesitate to reach out to me for help, coaching, questions, guidance, discussion, coffee, whatever, but not too much coffee.
And Brent, I love what you said, because not everybody's on the same step, the same page in regards to their knowledge or skill set around this, but those who are in HRC are very much aligned with their purpose and mission, their ideation, their recognition of the issue and desire to be a part of solutions. And so this is a way of helping people gain some of those skills so that they can take those steps forward together.
Denise?
Yes.
Is this recording, are
Yes.
we able to access it? Is it going to be?
It will be available. Yes, Judy.
Okay.
Good. Brent, if is the board locked down if I shared the link to the board with the recording so people could go in and test out their Miro skills as they watch the training you gave?
Yeah, no, it is not locked down. So that's a good thing, and that's just a good thing. We'll just say everybody can go back into it if you grant access, Denise. And the one thing that I would caution about is when everybody has edit rights, so the content and the arrangements may change as multiple people get in, but that's all right. That's part of, hey, we're okay with learning, and that's part of the learning experience.
Excellent. Then I'll share the link so that if you want to get in and test again, you can with the recording and your own screen to play with.
Yeah, because I was lost at the beginning and then it started to make sense later on.
Good. I saw you in there adding things.
I found out that I had to make an account with this company. I mean, I couldn't get into it.
You shouldn't have had to. Interesting, Judy.
Yeah. And Judy, you and I are LinkedIn friends now too. I'd be happy to go back over some of this with you too.
And I'm sure we'll be in contact.
Good.
Right. Well, thanks everybody for showing up. And I hope you come back on September 11th. We're going to dig in deeper, and the 25th as well.
All right. Look forward to seeing everybody.
Yeah.
Have a great afternoon.
Have a good Labor Day coming up. Bye-bye.
Bye.
Bye.
Goodbye. Thanks so much.